Imagine feeling as if you are watching your own life like a movie, detached from reality. It's like experiencing life through a fog or glass wall. You're physically present, but feel disconnected from yourself and the world around you. Or perhaps the world around you seems unreal, distant, or distorted, like a dream that you cannot wake up from. This is the unsettling reality of depersonalization derealization disorder, DPDR, a mental health disorder characterized by persistent or recurring feelings of detachment from your body, thoughts, or surroundings. While many people might experience brief moments of depersonalization or derealization during times of stress or trauma, when these feelings become persistent and interfere with daily functioning, it may indicate this disorder. People living with this disorder typically maintain intact reality testing, like they know their feelings of unreality are just perceptions rather than reality itself. This distinguishes depersonalization derealization disorder from psychotic disorders, where people lose touch with reality. Despite understanding these feelings are just perceptions, the experience can be extremely distressing and disorienting, often leading to anxiety about going crazy or having permanent brain damage. However, neither is true. The condition typically develops during adolescence or early adulthood, with the average age of onset around 16 years old, though it can begin at any age. It affects approximately 1 to 2% of the general population, making it relatively rare but certainly not uncommon. Interestingly, transient experiences of depersonalization or derealization are quite common, with up to 50% of people experiencing them briefly at some point in their lives. The full disorder, however, involves chronic or recurring episodes that cause significant distress or impairment in important areas of functioning. Symptoms of depersonalization derealization disorder. The core symptoms of depersonalization derealization disorder revolve around feelings of unreality and detachment. People typically describe an unsettling sense of detachment from themselves, feeling like they're not in control of their speech or movements, or observing themselves from a distance. A person may look in the mirror and not recognize their own reflection or feel like their thoughts are not their own. The condition often includes emotional numbing, where emotions feel inaccessible or unreal, as if the person is unable to feel deeply. They might recognize that they should feel emotion in certain situations, but experience themselves as emotionally empty or disconnected. Time perception is also frequently altered. Some individuals describe time as standing still or moving too quickly, making it hard to grasp how much time has passed. Others feel as if their memories are distant or disconnected from their personal identity, as if they belong to someone else. In terms of derealization symptoms, individuals often describe the world as looking surreal, blurry, or artificial, almost as if they are in a video game. Objects may appear larger or smaller than they actually are, and the environment may seem flat or colorless. Many people feel as if they are behind a glass wall, unable to fully engage with their surroundings. Sound distortions are also common, and they can include voices sounding muffled or unusually loud. Some people report feeling like they're on autopilot, going through the motions of daily activities without feeling fully present. These experiences are often accompanied by intense fear, as individuals worry that they are losing their minds or going insane. While DPDR itself does not cause psychosis, the experience can be terrifying, leading to anxiety and depression. This anxiety can create a vicious cycle where worrying about the symptoms actually intensifies them. The disorder often leads to social withdrawal, as people struggle to connect with others while feeling detached. They might avoid situations that trigger symptoms or find it difficult to engage in activities they once enjoyed because nothing feels real or satisfying. Episodes can be brief, lasting hours or days, or chronic, persisting for weeks, months, or even years with fluctuating intensity. Many people report certain triggers that worsen their symptoms, including stress, fatigue, sensory overstimulation, or specific environmental factors like fluorescent lighting or crowded spaces. Physical symptoms sometimes accompany these experiences, including dizziness, lightheadedness, headaches, and problems with coordination or balance. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of Depersonalization Derealization Disorder. There is no single cause of DPDR, but it is believed to result from a combination of psychological, neurological, and environmental factors. One of the leading theories suggests that it is a defense mechanism triggered by severe stress or trauma. When a person goes through an overwhelming experience, their brain may respond by detaching from reality to protect them from emotional distress. Childhood trauma, such as abuse or neglect, is often linked to the development of dissociative disorders, including DPDR. Another possible cause is chronic anxiety and panic attacks. People who suffer from generalized anxiety disorder, panic disorder, or PTSD often report symptoms of depersonalization and derealization. This is because high levels of anxiety can lead to hyperawareness of one's thoughts and sensations, making them feel disconnected from reality. Substance use is also a common factor, as recreational drugs like cannabis, hallucinogens, or even excessive alcohol consumption can trigger dissociative experiences, which may become persistent in some individuals. Some researchers believe that neurological factors play a role in DPDR. Brain imaging studies suggest that there may be an imbalance in the brain regions responsible for emotion regulation and perception, such as the prefrontal cortex and limbic system. These abnormalities could explain why people with DPDR struggle to process emotions normally and feel disconnected from their surroundings. Diagnosis of Depersonalization Derealization Disorder. There's no specific blood test or brain scan that can definitively identify the condition. Instead, diagnosis involves a comprehensive evaluation by a mental health professional, typically a psychiatrist or psychologist with experience in dissociative disorders. The clinician will ask detailed questions about your experiences of depersonalization and derealization, focusing on the quality and intensity of these sensations. They'll want to know when you first noticed these feelings, whether they come and go or remain persistent, and what seems to trigger or worsen them. It is crucial to rule out other medical or psychiatric conditions that can cause similar symptoms, such as epilepsy, brain tumors, or schizophrenia. To do this, a doctor may recommend neurological examinations, imaging tests like an MRI or CT scan, and blood work to check for underlying medical issues. Additionally, they will assess whether drug use or medication side effects could be contributing to the symptoms. Special attention is paid to distinguishing this disorder from psychotic disorders. People with depersonalization derealization disorder maintain reality testing. They know their perceptions are unusual and don't represent reality. This differs from psychosis, where people lose touch with reality and may have delusions or hallucinations they believe are real. For a formal diagnosis, symptoms must cause significant distress or impairment in social, occupational, or other important areas of functioning. Treatment for depersonalization derealization disorder. While complete symptom resolution of the condition isn't always possible, many people experience significant improvement with appropriate treatment. Here are the primary approaches. Number 1. Psychotherapy. The most effective treatment for DPDR is cognitive behavioral therapy, CBT. This therapy helps individuals recognize and change thought patterns that contribute to feelings of detachment. By addressing underlying anxiety, trauma, or negative thought loops, CBT can help individuals regain a sense of connection with themselves and the world. Another effective therapy is grounding techniques, which involve focusing on sensory experiences, such as touch, sound, or smell, to bring a person back to the present moment. Number 2. Medication. While there is no specific drug approved for DPDR, certain medications can help manage symptoms. Selective serotonin reuptake inhibitors, SSRIs, commonly used for anxiety and depression, have shown some effectiveness in reducing dissociative symptoms. In some cases, mood stabilizers or low-dose antipsychotics may be prescribed, but their success varies from person to person. Medications are usually combined with therapy for the best results. Number 3. Stress management. Since stress and anxiety are major triggers for DPDR, learning stress management techniques is essential. Practicing meditation, deep breathing exercises, and progressive muscle relaxation can help calm the nervous system and prevent dissociative episodes. Regular exercise is also beneficial, as it releases endorphins that improve mood and reduce anxiety. Number 4, lifestyle changes. Adopting a healthy lifestyle can significantly reduce DPDR symptoms. Avoiding alcohol, drugs, and caffeine, maintaining a consistent sleep schedule, and engaging in activities that promote emotional connection, such as socializing or creative hobbies, can help individuals feel more grounded in reality. Number 5, trauma-focused therapy. For individuals whose DPDR stems from childhood trauma or PTSD, eye movement desensitization and reprocessing therapy or trauma-focused cognitive therapy can be highly beneficial. These therapies work by helping individuals process and integrate traumatic memories in a healthier way, reducing the need for dissociation as a coping mechanism. Now, we want to hear from you. Have you ever experienced moments of depersonalization or derealization? What did it feel like, and how did you cope with it? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.